Hello there, a very good evening to all of you, and you're joining another episode of IMED today as well. And we take care of your health, especially we give you tips about health and what you should concern about. And today we thought of discussing another very important aspect of your health, that is oral health. And to do the honors, we do have with us today Dr. Sirimevan Samarakon, consultant in restorative dentistry at Teaching Hospital Ratnapura and also a visiting lecturer at University of Peradeniya. Good evening to you, doctor.
Good evening.
Now, first of all, today we thought of discussing about, to start with, oral cancers, which has been a major issue, not only in Sri Lanka, but in other countries as well. Would like to know about the disease burden of oral cancers here in Sri Lanka especially.
It's a very timely question that you ask, because what we see here in Sri Lanka is an increasing trend, especially in oral cancer. So if we talk about the general population in Sri Lanka, we have the oral cancer as the most commonest one among males, and among females is the sixth most commonest, and in the overall population it comes down to the second most common type of cancer in the entire country. And earlier we used to have this presumption that it is an disease of the elderly, and now we have seen an increasing trend that the young population, because of various activities that they have taken up in the past, are experiencing more and more of oral cancer related issues. And if I quote a number, it's like around 4,000 new cases are being reported every year. And the disease burden is somewhere around almost 16 per cases for 100,000 of the population, which is you can call it as a pretty high figure in this part of the world.
So, doctor, what are the predisposing factors of oral cancers?
Well, the predisposing factors could be termed as most of the time which are related to the human activities. So, as you probably would know that any activity which we consider as unhealthy is always connected with oral cancer as well. So, things like consumption of alcohol, consumption of tobacco, and use of tobacco related products, and along with that the betel chewing and various areca nut products, and especially the lifestyles of the people, the nutrition, and the way that they are educational thinking, or the way that they are thinking about various activities in their normal day-to-day lives, everything plays a part in oral cancer, because it can be termed as a type of a cancer which is very closely associated with human activities. So, as long as you take certain measures to curb your social activities, to correct the way that you eat, drink, and behave in the society, it is always a disease which you can keep it at bay.
And meanwhile, doctor, now how can a oral cancer present to the clinic or to a doctor, and especially how does this diagnosis process takes place?
Well, as you can see in this slide, we can see that we can always have this amount of what you can call it as signs be visible in gingiva, that is the area between the tooth, or rather just beyond the margin of the tooth, or the mucosa, that is the soft area inside the mouth, or in the lip, or in the buccal mucosa, and sometimes in the vestibule, or that is in the area between the cheek and the teeth, and sometimes in the hard palate, that is on the upper jaw, or even the soft palate, the movable part of the palate, or the tonsil area, where the tonsils are located, and as well as on various surfaces of the tongue, either in the lateral border, or in the tip, or in the floor of the mouth. All these areas are very, very vulnerable to have oral cancer lesions. And the beauty of this is, all these areas, or most of these areas, can be seen by yourself. It's not a condition where it will go unnoticed by the person who is having it. So, if you take trouble to have an examination of yourself, if you are really looking after yourself in the proper way, you can always detect various symptoms, which I will be obviously talking about, very early. So, the early detection saves lives in oral cancer.
How does it present, doctor? As in ulcers or wounds, or what are the other presentations of
Well,
cancer?
if we go to this one, you can see this on the side of the tongue, or rather lateral border of the tongue, you can see a small ulcer. And on the second one, you can see a white lesion on the palate. And in the floor of the mouth or underside of the tongue, you can see a bluish discoloration. And in the inside of the lip, you can see ulcers. These are very, very common presentations. These presentations might be of a reddish color, might be a whitish color, or it might be having a striate appearance, or it might go unnoticed at all, and it might not give you any issues, or rather it might not give you any discomfort. But as long as you are somewhat conscious about what to look for, and if you notice certain changes that are taking place, and if you have noticed that these changes have taken place and it has been persistently in these areas for more than 2 weeks, then it is time to take notice, and it is time to visit a doctor and to get that area examined, and most probably sometimes by various other methods of investigations as well, and quickly come to a conclusion of what type of disease that you are having.
And are there any treatment options available here in the country, doctor? Is it curable?
Yeah, it is. That is a very, very important question in the sense, because like what I wanted to emphasize early detection of oral cancer not only saves lives, it improves the quality of life as well. So if you detect the issues early, then with very simple treatments like a very small surgery, you can completely cure the cancer, or you can completely remove the cancerous lesion. And if it is in a certain advanced stage, but still you can completely cure the cancer. So in that stage, not only surgery is required, but along with that radiotherapy, and along with that chemotherapy might be required. And along with radiotherapy and chemotherapy, there might be indications to do targeted cell therapy or immunotherapy. Those are the newest types of treatment modalities which has come into practice in Sri Lanka as well. But unfortunately, what I have experienced, especially in the estate sector or in the areas where people are not so knowledgeable about how to maintain their oral health, and where they are not really concerning that much effort into maintaining their overall general health, they present with very, very late stage cancer symptoms. So in that case, all what we can do is we can resort to palliative treatment, that is to improve the quality of life while it lasts. So those are the treatment options that are presently available in Sri Lanka for that.
And doctor, one can think like if this person got a normal ulcer, thus also some kind of an ulcer, small wound inside the mouth, inside the oral cavity, is there a tendency of it converting into an oral cancer?
There is a tendency if it lasts for more than 3 weeks. So we usually call it as non-healing ulcers. So there are two types of ulcers. There are minor abscess ulcers and major abscess ulcers. Minor abscess ulcers, actually it doesn't have any tendency, and there's no danger of it being converted into a cancerous lesion. But a major abscess ulcer happening and occurring frequently and lasting for more than 3 months, sometimes it has a chance to develop into a cancerous lesion. And in that sense, first of all, when you go to a hospital, they will be taking a biopsy. So the biopsy might be a excisional biopsy where the entire lesion, if the lesion is small, and it might be an incisional biopsy if the lesion is very large. And sometimes, depending on the area where you can reach for the biopsy, it might be a fine needle aspiration biopsy. So using a biopsy, we can determine, we can 100% say whether it's a cancerous lesion or not, and we will be staging the cancer as well. And depending on the stage, we have to come to a conclusion what type of treatments that are needed, and the most possibly the prognosis of the patient as well.
We discussed about the signs and symptoms, the presentation, the treatment modalities, and now let's come to the most important point, how to prevent oral cancers.
Exactly. So, the beauty of oral cancer, if I might say, is it is 100% preventable. So, we have identified a lot of things which are related to oral cancer, and like what I emphasized earlier, is also it's almost always is related to human activities. So, if we have a look at what I have placed here is like the tobacco products that are available. You might be amazed to know that the tobacco the amount of varieties of tobacco products available in this part of the world is amazing. It's quite amazing in the sense because the type of tobacco products that are being consumed by Asian population is mind-boggling, because you use it to smoke, you use it to chew, you use it that is called snuff dipping, you use it sometimes to keep it in your buccal cheek for a certain amount of stimulation, and sometimes some people eat it as well. So, tobacco is found to be very, very carcinogenic, and actually there are certain mixtures that have been banned from certain countries as well. So, overall tobacco is a very harmful substance, not only for oral cancer, as you know, even for lung cancers or even other esophageal cancer, even other cancers in the entire body. It is not so what you can call it as a suitable product to be consumed at any time. And if we go to the next one, this is what I have taken as a type of areca nut products. Now, areca nut, we have used it from time immemorial in this country, and it has been sort of integrated into our society as well. And many people, either lay or even people from religious background, they use it. But unfortunately, it has been found that areca nut contains a lot of carcinogenic substances, and it is very detrimental in the longer run, because sometimes it gives rise to potentially oral malignant lesions as well, something like oral submucous fibrosis. So, it's very, very important that if you are into betel chewing, that you should forego using tobacco products along with areca nut when you are using betel. And as you can see, there are a lot of betel chewing along with areca nut which has been used to stimulate each other. So, all these areca nut products, some things are available in Sri Lanka, most of these things are available in India. So, they are acting as a stimulant, as well as you can call it as a addictive product as well.
So, betel alone is okay?
We cannot say it is okay, but the research shows that betel taking along with tobacco as well as areca nut is the most harmful product. So, there has not been that much of research which shows betel chewing itself without any products integrated into that has certain carcinogenic activities. But overall, even though it does not contain any carcinogenic products, the betel chewing itself is not really, we can call it as a productive habit to be indulged with. So, if we can go to the next slide, this entire mixture has been now banned in Sri Lanka. But to tell you the truth, even though it's been banned in Sri Lanka, you can see this product being utilized day in, day out, especially by people who are into working long hours. So, they use it as a stimulant, to keep them, to prevent them from falling asleep, or to make them concentrate on something. And sometimes in plantation sector, they use the quid which they produce after chewing this to apply on their skin to prevent leeches getting attached to the skin. So, they have always come up with certain excuses to use these things, but it is very detrimental to the not only to the oral health, to the general health, and the burden or the price that they pay later on after indulging in this sort of habits is immense.
So that's about oral cancers, and also now we'd like to know from doctor that regarding other dental injuries other than oral cancers, what are the common ones here in Sri Lanka?
Well, in Sri Lanka, for the last 30 or 40 years, we have seen an increasing trend in dental injuries. Major cause of those injuries is because of road traffic accidents. And on top of that, because of increased human activity and the congestion that it has created, has leads to various socio-economic problems such as interpersonal violence, and sometimes due to various activities which involve a lot of people. So dental treatment for those dental injuries should be prompt and should be taken to the correct place to get the treatment from, and if you diagnose it properly, it will prevent further issues coming up later in life. So as you can see in this one, dental injuries can be termed into two major categories. It can be termed as luxative injuries, which involves the entire root or part of the root, and the maximum amount of luxative injuries that you can experience is the avulsion, that is the complete loss of tooth from the socket falling off of the tooth, or else part of the tooth getting broken off. Those are called fractures. So it can involve either the enamel, or it can involve the dentine, or it can involve the pulp, or rather the nerve part which houses inside the tooth. Out of these types of injuries, avulsion, which is the most prominent and most important one that you have to attend to, should be attended promptly, if possible within an hour's time, by a dental surgeon. And if you are to take the tooth to that place for the treatment, either to the hospital or to a clinic, you should carry it in a solution. The best solution is the king coconut water. In Sri Lanka there is available, or if it is not available, or any type of milk would do. Even if that is also not available, either saline, or at least the patient's own saliva would be a better medium to carry that tooth. And the promptness, remember your promptness in seeking the treatment will result in most possible option of saving the same tooth as well.
How about the management of this kind of dental injuries, doctor?
Well, the management of dental injuries varies from you can call it as the types of the fracture or the types of injury that the person has suffered, and depending on the amount of time that the person has been exposed to this trauma, and depending on how patient is motivated to get further treatment. So like what I stated earlier, if the patient comes promptly to the hospital and the patient gets the treatment promptly as well, then the management will be either simpler treatment like covering up the exposed part, or if the patient has brought up the part which is broken, we can always reattach that part. And most probably in certain cases, if the pulp is exposed, then we have to do root canal treatments for that tooth. And sometimes even if the person has brought that tooth in the correct order as well, if there is no possibility of saving that tooth, then we might have to remove the tooth, or we might have to plan to remove the tooth and to come up with some kind of you can call it as substitute for that created space.
Prevention of this kind of injuries is also very important in that case, isn't it?
Exactly, because it's the most easiest thing to do is to make certain changes to your lifestyle. If you are say for example, if you are a motorcycle rider, the best thing is to wear a helmet which is having a full face cover instead of a normal helmet, because you don't know at what time of the day that you might meet with an accident. And if you are a motorist, best thing is always, I know it's applicable by law as well in Sri Lanka, you have to always wear a seat belt. And if you are a person who is into contact sports or a person who is getting physical contact, it's best that you wear a mouth guard. And this is not only applicable for the adults, it's always applicable for children as well. And especially if you have children and if you have a household, it's always best that you educate your children in such a way that if they are playing and if they want to play, the best thing is to play outside instead of inside the house, because when you experience dental surgery, dental injuries, and if the injury is against a ground or against a surface which the pressure is absorbing, then the patient tend to get less amount of seriousness of the injury. If it is happening on a cemented floor or a tile floor or a floor which is very hard, then the type of dental injury that we have observed is somewhat severe.
So that is how to prevent dental injuries. And doctor, especially as we are in the pandemic era, so it has been very hard with our normal lifestyle as well. But when it comes to dental health, when it comes to oral health, how about the tendency of the people, especially here in Sri Lanka, towards dental treatment? Are they hesitant to come to the clinic, or how is it?
To tell you the truth, they have been hesitant to visit dental clinics and even hospital dental clinics from the first wave onward, and I can understand their hesitancy. And because obviously into the first few months of the pandemic, everybody was grappling around to formulate certain plans on how to get on with your normal routine treatments. But now world has come up with certain game plans for various types of treatments. So what we do is in Sri Lanka, with the associations as well as the ministries has come up with various, you can call it as advices regarding various types of treatments which should be given, and especially where it concerns aerosol generating procedures, where you use various machines to drill teeth or various machines to shapen teeth or to clean teeth. Those are called aerosol generated procedures. Then we have to use the full protection, and it should be applicable not only to the doctor, it should be applicable to the nurse as well, and it should be in an enclosed environment. And if the patient is in the government hospitals and even certain private hospitals, if the patient is coming, even if there is no history, usually we perform a rapid antigen test before we do aerosol generating procedures. And now the tendency for anywhere in the world is to plan dental treatment. Unless it's essential, we don't treat patient in the first visit itself. Emergency dental treatments, of course, we have to do, but in all the other cases, the consultation will be taken, and in the consultation we find out all the problems, and we plan in such a way, so when the rapid antigen test was done, we do all the aerosol generating procedures in one visit. So it is beneficial for the patient as well.
Some treatments can wait in that case.
Exactly. Yeah.
Well, that's about oral cancers and also about dental injuries, what are the treatments available and how we can present. So to give you all this information today, it is Dr. Sirimavan Samarakun, consultant in restorative dentistry, who was with us today from the teaching hospital of Ratnapura, as well as a visiting lecturer at the University of Peradeniya. Thank you very much, Doctor, for giving all this information to our viewers. It has been very important to know about our dental health, our oral health as well. So we invite you to join another episode of iMed as we conclude tonight's episode for iMed. Have a pleasant eve. Good night.